The American Brain Tumor Association is pleased to welcome you back to our webinar series. Our webinar today will discuss returning to work after a brain tumor diagnosis. My name is Vince Rock, Program Manager here with the American Brain Tumor Association, and I'm delighted to introduce our speaker today, Monica Bryant. Ms. Bryant is a cancer rights attorney, speaker, and author. She is dedicated to improving access to and availability of quality information on the practical, insurance, and financial issues surrounding a cancer diagnosis. Ms. Bryant is the co-founder and chief operating officer for Triage Cancer, a national nonprofit organization connecting people to cancer survivorship information through a national speakers bureau, educational events, and online tools. Thank you for joining us, Ms. Bryant. You may now begin your presentation.
Thank you so much for having me. It's great to be here today, and we're going to spend the next hour or so talking about returning to work after a brain tumor diagnosis. The mere concept of returning to work can be incredibly daunting, and there are many motivations for someone wanting to return to work. For example, we often hear that people appreciate kind of the getting back to some semblance of normal, the routine that work provides them. For others, it's really more about the finances. And then finally, for others, it's really a mixture of things that makes people want to return to work. So today we're going to talk about some of the rights and benefits you might be entitled to in the workplace and some tips that hopefully make the process of returning to work a little bit smoother. Now, if you've ever tried to put together one of those giant jigsaw puzzles at some point, you could imagine that it would be even more difficult to complete if you never saw the picture on the box of what the final product was supposed to look like. And that's how it can feel sometimes when you're trying to navigate this complex maze of work and cancer. Once you're diagnosed, you kind of find out along the way that there are so many things that you need to think about and to deal with, but you don't always have a view of the overall big picture. So throughout the hour, I'm hopefully going to start to give you some of the pieces to help you put the puzzle together. And so what are the let me take a step back. Per the rules, I have to disclose that I have no stocks or patent rights or employment with any company, and the information that I'm providing today isn't biased by any sort of money that I might guess. So today we're really going to talk about some of these puzzle pieces, and for each one of you, you're going to have to take these pieces and create your own overall puzzle picture. And by pieces, I mean the federal and state laws that we're talking about, workplace culture, contracts, your actual medical treatment, the financial pieces, and of course, insurance. Now, the unfortunate reality is that a cancer diagnosis is probably going to negatively impact your finances. And that impact on finances is now often being referred to as, quote, financial toxicity. It's a relatively new term for the costs that are associated with a cancer diagnosis, but this certainly isn't a new problem. And some of the things that contribute to this financial toxicity might be about health insurance status, and it might also be about life changes. You know, a diagnosis doesn't come with a pause button for the rest of life. So in addition to dealing with a brain tumor diagnosis, you might also be starting or ending a relationship, moving, retiring, graduating from school, or starting school. All of those things are also going to have an impact on your finances and ultimately your employment. And then finally, what we're going to spend most of today talking about are going to be some employment changes. You may have decided not to work, or you may have decided to go from full-time to part-time, or you may decide to try to work through treatment. So we want to talk about some protections that you might have as well. Now, because they only gave me an hour to talk today, I do just want to mention that throughout today's presentation, I'm going to be pointing you to other resources, both on ABTA's website and on Triage Cancer's website, to give you more information about various topics, because really, again, I just want today to be the start of a relationship and sort of an overview, but know that this doesn't have to be your only opportunity to get information. And one of the places that you can get some information is a tool that we've created called cancerfinances.org. It's a website where you can get personalized answers to your questions around managing finances. It's sort of built in a choose-your-own-adventure way. So depending on your answers to questions, it will lead you down a path to various information. We currently have modules up about health insurance as well as disability insurance and financial assistance options. So please check that out if you have questions about any of those things. Throughout the rest of the year, we'll be adding some more information about employment and other financial factors. And then also Triage Cancer has an educational blog where we are posting late-breaking news as often as we can, and we have a ton of information there, especially about some of the upcoming potential changes to healthcare. But on to the topic of today, employment rights. There are actually a number of places where you can go to find information about your employment rights. There are federal fair employment laws, the Americans with Disabilities Act or the Rehabilitation Act. There are state fair employment laws. There are leave laws, the federal leave laws, the Family and Medical Leave Act or the FMLA. And then there are state leave laws as well. But you could also be an employee working under a contract or a member of a union. So you may have additional rights or options based on that contract, and you should definitely be sure to look at that specific contract for any additional employee benefits that you might have. And as we talk about rights and benefits, it's important to remember that the state and federal laws are only the bare minimum of what employers must provide to their employees. But there are also tons of employers out there that provide benefits that are much better than those bare minimums. So it's a really good idea for you to look at your specific employer's policies. And these can typically be found in some sort of document like an employee manual or a policies and procedures document. Generally, we get a huge stack of paperwork when we start our jobs, and we sign what we have to sign, some goes to HR, and if you're like me, the rest ends up in a bottom drawer somewhere, and it only gets pulled out if there's a problem. I recommend that everybody at least take a look through it when they're first hired and then refresh every so often, because again, if you don't look at what your employer's policies are, you might be missing out on some things. Now, if you don't have access to this, maybe asking a coworker or a human resources representative or whomever in the company deals with things like pensions and health insurance for the information. So what should you be looking for? Some of the things that you might want to look for are going to be things like insurance options, health insurance, dental, vision, disability insurance options. For example, does the employer already have a policy in place that allows for telecommuting or some kind of flex time? Maybe your employer is one that allows other employees to donate their paid time off to a pool that you could draw on once you've exhausted your own paid time off. Again, really, really important to check for these things, because how can you access these benefits if you don't even know they exist? And then typically a good employee manual is also going to lay out a process for how an employee can ask for some type of medical leave or reasonable accommodation. So this can really be a great source of information and avoid a situation where you are reinventing the wheel. Now, the first law that I want to talk about is the Americans with Disabilities Act, or the ADA. Now, a lot of times people who are diagnosed with cancer or a brain tumor don't consider themselves to have a disability, and therefore don't necessarily think that they're going to be protected under the ADA. But this is one of those situations where I really urge people not to get caught up in the labels, because you might end up missing out on protections you're entitled to. So the ADA is a federal law that prohibits discrimination against people with disabilities in several contexts, including in the workplace. But not everybody is going to be eligible for protection under the ADA. There are a few hurdles that a patient will have to jump to be protected. So first, you have to work for a private employer with 15 or more employees, or for a state or local government. Now, if you're a federal employee, you are probably going to be covered under the Rehabilitation Act of 1973. It is very similar to the ADA in its employment protections, but very important for people to know what law they're accessing their rights under. So first hurdle is working for a big enough employer. The second hurdle is to ensure that you are a qualified individual. Legally, that means that you are an individual who can perform the essential functions of the job with or without a reasonable accommodation. Practically, what that means is, are you qualified for the job in question, and can you perform the essential job responsibilities? But you can get help to do that through an accommodation, and we'll come back to accommodations in just a few minutes. Now, the last hurdle that you'll have to clear is you have to have a disability within the ADA's definition of a disability. And over the course of today's webinar, you'll hear me use the word disability a few times, but it's important to remember that every law we talk about has a different definition. So under the ADA, a disability is a physical or mental impairment that substantially limits a major life activity. And I realize that that's a mouthful, so let's break it down. First, you have a physical or mental impairment. Second, that physical or mental impairment limits a major life activity. And third, that limitation is substantial. So what's a major life activity? It's going to be anything that the average person in the general population can perform with little or no difficulty. So major life activities can include things like sleeping, walking, breathing, eating, operation of major bodily functions. And when we're talking about cancer, oftentimes it's not the cancer diagnosis itself that creates the disability, but rather it's the side effect from treatments that somebody's experiencing, like nausea or chemo brain, fatigue, anxiety. And it could be that one of those side effects is substantial all by itself, or that it's the combination of those things that creates a presence of a disability under the ADA. One other important thing to remember when thinking about if somebody has a disability under this definition is to make sure that you're looking specifically at that individual and how their medical condition is affecting them. In other words, we can't just classify everybody who's been diagnosed with a brain tumor as having a disability. So once we've determined that a patient has cleared all of those hurdles and is therefore protected under the ADA, there are 4 ways that someone can use the ADA's protections. First, if you currently have a physical or mental impairment that substantially limits a major life activity. So maybe you're currently going through treatment and suffering from extreme vertigo, which is making getting through the workday next to impossible. The second way is by having a history of having an impairment. So maybe you're 10 years out from active treatment with no current symptoms, but your employer is treating you differently because they know of your history of having a brain tumor. And the third way is being regarded as having a disability. And this really isn't about your experience or capacity at all, but rather it's about the employer's perception of you. And the employer is perceiving you as having a disability, even though you might not be substantially limited in any way. So for example, maybe you've lost all of your hair, but other than that, you're doing quote unquote okay, and you want to go to work. But because of that bald head, your employer is treating you differently. You would fall under the regarded as prong. And then the fourth way that you can be protected is based on an association with a person with a disability. And this is where caregivers might be able to be protected from discrimination under the ADA. The ADA applies to all phases of the employment process, which means that it doesn't just provide protections once you're an employee, but it also provides protections if you're a job applicant. So before you even get the job, you are protected under the ADA if you've met all of these qualifications. So let's say that you've figured out that you qualify for protection under the ADA. What does it actually get you? In all four of these circumstances that I've just talked about, the ADA is going to protect you against discrimination in the workplace. In other words, it's going to protect you from being treated differently because of your medical condition. Now, if you currently have a disability under the ADA or have a history of having a disability, in addition to being protected from discrimination, you may also be entitled to a reasonable accommodation, which I promise we will get to. Now, as I mentioned when I first started, there are also state laws that are similar to the ADA. But the good thing to know about state laws is that some of them can actually be more protective than the federal law. And one of the ways that the state laws can be more protective is that they can actually cover smaller employers. So if you remember, the ADA covers private employers with 15 or more employees. So what happens if you work for a small business? This chart shows the number of employees that each state requires an employer to have to be covered by the state Fair Employment Law. So I'm currently in Illinois, and as you can see, Illinois is in the first column. So here, an employer only has to have one employee in order to be protected. So as long as you don't work for yourself and discriminate against yourself in Illinois, you are protected. If you don't see your state listed here, then it means that it's the same as the ADA. So it covers employers with 15 or more employees. Now, one of the most common questions that we hear for people in the area of work and cancer is, do I have to tell my employer or my potential employer about my diagnosis? And the answer is generally no. You are not required to share information about your medical condition, except in three main instances. So first, if you want to use the ADA's discrimination protections, you may have to disclose something. And the reason is that if you haven't disclosed anything about your disability, how could your employer be discriminating against you because of your disability if they don't know you have a disability? It's a little circular logic there. Second, if you are trying to access reasonable accommodations, you will have to share some information about your medical condition. And finally, if you're asking for medical leave, same thing, you'll have to share some information. But in all of these circumstances, it may not be necessary to disclose a specific diagnosis as long as you can provide enough information to justify the need for a particular benefit. Now, for an in-depth conversation about disclosure, I point you to something that we call our quick guides. And we have quick guides on various topics, and they're designed to be a sort of bite-sized introduction to a particular topic, I think 4 pages at the most. And you can access it here at this link that I've provided. Now, I wanted to take a brief stop to talk about chemo brain. Chemo brain is a common term now used in the cancer community to describe the thinking or memory or cognitive problems that can occur after treatment. But studies have shown that these cognitive challenges aren't just a result of chemo, but they can be a result of surgery, radiation, endocrine therapy. All of these therapies and treatments can create cognitive challenges. So we put chemo brain in quotes because it really is a misnomer. Studies have shown us that about 60% of patients experience some cognitive problems post-treatment. I suspect, and I have no proof of this, but I suspect the number is probably much higher. It's just a little harder to pinpoint or identify these cognitive issues. And the other piece of this is that a lot of times these issues were present prior to treatment, and that there are other factors that can contribute to cognitive decline, like age and genetics. And the more and more research that's done in this area, we're seeing that so many things can affect cognitive function, including stress and depression, anxiety, sleep issues, because none of these things come in conjunction with a cancer diagnosis. So again, chemobrain really is a misnomer. It does reason, however, that dealing with some of these practical things that can affect cognitive function can improve things overall and hopefully lessen the negative impact of chemo. So we're talking about things like ensuring adequate sleep, appropriate levels of exercise, when appropriate, using medication, and then chemobrain at work is a serious issue. And so again, we have a whole quick guide on our website that you can download for free about specific tips and tricks on how to cope with chemobrain in the workplace. All of that leads us to a discussion about reasonable accommodations. So reasonable accommodations are any change in the work environment or in the way that things are customarily done that enables an individual with a disability to enjoy equal employment opportunities. Now, I recognize that this is a relatively vague statement and possibly confusing verbiage. So the best way for me to explain reasonable accommodations is with some examples. There are three main categories of reasonable accommodations. The first category is about modifying one's physical workspace. So this might be about getting brighter or dimmer lights in your workspace if light sensitivity is an issue. Or maybe it's about a special chair with a headrest. Or maybe it's about switching offices. So let's say, for example, you're having a hard time concentrating and your office door happens to open out to the elevator bank where there's constant dinging of the elevators and people coming in and out and chatting. So all of that movement and sound can make concentrating even harder. So your reasonable accommodation might be about switching to an office further away from the elevators. The second category of reasonable accommodation is about modifying a schedule. So maybe it's about working from home, if that is helpful. That can be particularly useful for people who are dealing with fatigue, because now they don't have to try to deal with their commute, or even the whole process of getting dressed and looking presentable for the day can be exhausting. So if you take that piece plus the commute piece out, and you're just focused on getting your work done, that could make things much, much better. Maybe it's about a flexible schedule. So you need to work 8 hours a day, but maybe you can work from 7 to 3 instead of from 9 to 5 if that's when you are best. It could be about getting more scheduled breaks. So if you have 2 15-minute breaks and a 30-minute lunch, but what really you need is spaced breaks the day, maybe you can get 6 10-minute breaks or 4 15-minute breaks. And then the last category is sort of the everything else category. So it could be about utilizing technology. And this is a really great accommodation that sometimes gets overlooked. So if you're having some memory problems, maybe it's about using a tape recorder or a smartphone in meetings to record the meetings so you can just participate rather than being stressed out trying to keep track of everything and scribble down to-dos during the meeting. It might be about having an employer change their policy. So one of the best examples comes from a real life court case, and this was a case where a gentleman was a valet at a hotel, and due to his cancer and treatment, he had to use the restroom quite frequently and didn't always have a lot of time to get there. The hotel policy was that staff could not use the restrooms in the lobby, but had to walk all the way around the hotel and use the staff entrance. Well, one day this gentleman wasn't going to make it. He used the restroom in the lobby and was fired. The case went to court, and the court came back and said this is an example where the hotel could have made a simple policy change for that one employee to allow that employee to use the restrooms in the lobby. Another example actually comes from a gentleman who contacted us, and in his words, due to his treatment, he had a, again, his words, a gnarly open wound on his forehead. And he wasn't trying to hide it, but he recognized that it made some people feel uncomfortable. And so what he wanted to be able to do was to wear a hat at work, but that was against his job's dress code. So his reasonable accommodation was a policy change where he was allowed to wear a hat. Very simple, but he said made a world of difference for not just him, but for all of his coworkers as well. An accommodation might be about shifting job responsibilities. So if you remember back to when I was talking about being a qualified individual, I said that you had to perform the essential functions of the job. Well, the reality is many of us are asked to do a lot more than just those essential functions of the job. So perhaps it's about shifting those non-essential responsibilities to somebody else. For example, a receptionist who's suffering from weakness could shift her responsibility of changing that giant water cooler bottle to somebody else. And then finally is the accommodation of last resort, as I like to say. It might be about moving to another job for a period of time. This accommodation only works if there is a vacant position. So employers are not required to create a new position for an employee as a reasonable accommodation. But let's think about an ER nurse who has a compromised immune system. Probably being in the ER where you never know what's going to walk through the door isn't the best place for that person. So maybe he could shift to another unit where there's a little less unknown, or maybe an administrative position where there's less contact with patients. So again, these are just some examples of how reasonable accommodations can be useful. Now, we hear from a lot of people, both employers and employees, that there's some anxiety around reasonable accommodations. One of the main things that we hear from folks is, from the employer side, they want to help their employees, but they're concerned about cost. And then from the employee side, a feeling that they are perhaps asking for a favor, or they have an employer that's been really, really great and they hate to, quote unquote, ask for one more thing. Well, there's an entity called the Job Accommodation Network, or JAN, and that's an entity of the Department of Labor. And its sole purpose is to help employers and employees figure out reasonable accommodations. JAN did a study a few years back and found that workplace accommodations actually don't cost all that much and can have a huge impact for both the employer and the employee. So this study found that 58% of all accommodations cost the employer absolutely nothing. So think about the employer, the hotel, who could have made the policy change to let the valet use the lobby restroom. That would have cost them absolutely nothing. Now, 37% of the rest of the accommodations had a one-time cost, typically of around $500. So maybe that's that new chair somebody needed, or a piece of software that would have made things better. So all in all, a relatively low cost when you think about what it would cost for an employer to try to find a new employee, train that employee, get them on, up to speed and all of that. And in this study, it was also quite interesting because not only did they find that accommodations really didn't cost that much, but that most employers that were calling JAN for help were doing so because they wanted to try to figure out how they could keep or promote a current employee. So a lot of employers are out there trying to figure out how they can help employees keep working. So when we're thinking about reasonable accommodations, again, sometimes people can feel like they're asking for a favor, and that can make them really uncomfortable. So it's really important to remember that this is a right under the law for eligible employees. And employers who fall under the ADA are required to provide employees with reasonable accommodations, unless that employer can show that it's an undue hardship or a direct threat. That is a very, very high bar to meet. Now, when you're thinking about reasonable accommodations, it's really going to depend on your individual condition and your job responsibilities. Accommodations have to be reasonable. So telecommuting, if you're a school bus driver, probably not going to be considered reasonable. So this is the major piece when you're thinking about what might work for you. It has to be reasonable. Also remember when I was talking about the side effects of treatment and how there can be more than one side effect, well, you can have more than one reasonable accommodation. And then if you remember back to when I started talking about the ADA, although caregivers are not legally entitled to reasonable accommodations, it can't hurt to ask. Many employers are much more generous than that bare minimum of the law. And if you think back to the Jan study I was just talking about, the same thing applies for caregivers. Employers want to retain valued employees. So it can be quite useful, even if you're not legally entitled to a reasonable accommodation, to ask for one. So that brings up some practical questions about how do you actually go about asking. Employees should always ask for an accommodation as soon as they realize that they need one. Because if you don't ask for an accommodation, whatever you're coping with may start to affect your job performance, and then the employer might start making some decisions like demotions or firing based on your job performance, because they don't know what else is going on. So it's important to really think about asking for reasonable accommodations as soon as you start to feel that there is a problem or a decline, so that your employer understands what's going on and doesn't fire you because they just think you've suddenly become a bad employee. So how do you ask? An employee does not have to invoke the ADA or specifically use the words reasonable accommodation in order for the employer to be obligated to provide that accommodation. An employer really should understand what the employee is asking for. However, we often see employees in the position of being required to educate their employers. So again, the Job Accommodation Network, or JAN, can be a really good resource for that. They have some tools that you can print off and take into a meeting with your employer about reasonable accommodations, and it can start the conversation. Now, when asking for an accommodation, you can certainly ask the person at work you feel most comfortable with, but I recommend first check that employer policy or manual to see if they have laid out a specific process for making these requests. Don't reinvent the wheel if you don't have to. Don't make it harder on yourself if you don't have to. But I also think that you should take into consideration your specific workplace. So if your direct supervisor is your biggest advocate, then perhaps going to your supervisor first is the best way to go. But if you just aren't sure, then maybe going to HR is better. People have mixed feelings about HR, so it's really going to be very much depend on your workplace. And when you ask for the accommodation, your request and your medical information is supposed to be kept confidential. So for example, your supervisor shouldn't be going into the staff meeting and announcing it. That being said, there are some instances when it might be necessary for your supervisor to be made aware of the accommodation. So it makes sense if you go to HR and you agree on accommodation that you're going to have every Friday off, it makes sense that your supervisor is going to be informed of that and not kept in the dark as to where you are every single Friday. And then everything with this whole situation is going to change, and it's going to be fluid. So things are going to change in terms of what you're experiencing, and things are going to change in terms of what you need. What you need in the midst of active treatment might be very different from what you need a month out or even a year out. So the accommodations can change with your needs. Now, once the request for an accommodation has been made, the employer and the employee are supposed to engage in what is called the interactive process. This is a legal term meaning that there has to be a negotiation of what accommodations might work, and then an ongoing assessment of whether or not that accommodation is working for the employer and the employee. So it can't just be a situation where you as the employee come in, ask your employer for a reasonable accommodation, the employer says no, period. It has to keep going from there. An employer might say, no, that doesn't work for us because it's an undue burden, but what would work would be X, Y, and Z. And then as the employee, you have a chance to respond. So it really is a very cyclical process, and it has to be a negotiation. Now, if you're sitting there thinking, well, I have no idea what kind of accommodation might work for me and the side effects that I'm experiencing, I definitely recommend the Job Accommodation Network. The Job Accommodation Network has this searchable online system where you can actually plug in the medical condition you're experiencing and your particular workplace setting, and it will pop out some accommodations that other people have actually gotten. So it can give you some really good examples, and even though those things that SOAR presents to you might not work for your situation, it can help you get the juices flowing, so to speak, in terms of ideas. Now, I just wanted to provide you with some very clear places to go for more information about reasonable accommodations. ABTA and Triage Cancer came together and created a guide of returning to work after a brain tumor diagnosis, and you can find that on ABTA's website. I've given you the link here, and even if you just Google ABTA and return to work, the link pops up. Here's the link specifically for that Job Accommodation Network online database I was telling you about. And then the final link here is to a page on Triage Cancer's website that has a whole host of employment-related resources. Now, I want to switch gears for the last couple minutes here and spend a little time talking about the Family and Medical Leave Act. So whether it's the employee themselves who's been diagnosed or, excuse me, the employee's caring for a loved one, that employee might have to take some time off for treatment and recovery. And that's where the FMLA comes into play. So the FMLA is a federal law that allows eligible employees to take time off to deal with their own serious medical condition or to act as a caregiver to a seriously ill child, parent, or spouse. We take a whole slide to talk about this because it is a very narrow definition of family. So under this law, people aren't entitled to take time off to care for a grandparent or a sibling or an aunt. Again, a very, very narrow definition of family. Now, some states are working to expand this on the state level, but it's pretty slow going. And then just like all the laws that we talk about, there are requirements that you have to meet in order to be eligible to use the FMLA. So first, an employee has to work for a big enough employer. And under the FMLA, that's an employer with 50 or more employees within a 75-mile radius. The reason we talk about the 75-mile radius is that if an employee works for an employer with multiple offices within 75 miles, the employee can add up all the other employees at each office to reach that 50 employee mark. So it can be really helpful, again, if you work for someone, an employer with multiple offices. In addition to working for a big enough employer, you have to have worked long enough. The FMLA requires that employees work for their employer for at least 12 months. And then employees have to have worked 1,250 hours during those 12 months. So it comes out to be a little bit more than part-time. Now, the 12 months do not need to be consecutive, only cumulative. And the FMLA allows us to look back 7 years to determine work history. So that means as long as you've worked for that employer a total of 12 months or more in the last 7 years, and you've worked at least 1,250 hours in the last 12 months, then you're eligible. So it does require a little bit of math and a little bit of thinking, but for more information about the FMLA, we have a quick guide that breaks down the different ways you can meet this hour mark. I think the most important pieces of this are an employer with 50 or more employees, and you have to have worked long enough, which is 12 months, and within the last 12 months, 1,250 hours. So once you've figured out that you're eligible for FMLA leave, what do you actually get? The FMLA entitles an eligible employee to 12 weeks of unpaid leave per year to deal with your own serious medical condition or to act as a caregiver. The FMLA leave is job protected, which means that when you return from leave, generally you're going to have to be reinstated to the same or an equivalent position that you were in when you started your time off. And an equivalent position is going to be one that has the same pay, benefits, responsibilities, and other conditions of employment. So in other words, you can't be demoted for taking FMLA leave. FMLA is also health insurance protected. So if an employer pays for a portion or all of your health insurance coverage, they have to continue to do so while you're out on leave. So they can't force you to take COBRA during FMLA leave or leave you without health insurance. However, that only applies to health insurance. So any other employer-sponsored benefit like disability insurance, life insurance, dental insurance, an employer has the right to stop paying their portion. So it's a good idea to ask what the employer plans to do with those other benefits so that you can make educated decisions about whether or not you're going to keep paying them or what if you're going to let those policies lapse. I also wanted to give you some tips with how to deal with FMLA. So when we say that the FMLA gives eligible employees 12 weeks of leave per year, what is that year period? Well, it depends, and it's actually up to the employer to decide. There are a couple of ways it can be decided. It can be a calendar year. It can be a year rolling backwards from when you last took FMLA leave. It could be a year rolling forwards from when you last ended FMLA leave. Or it could be any other fixed 12-month period. So again, policy and procedures document is a good place to look for how the employer is going to handle that. When an employee asks for FMLA leave, they're responsible for giving enough notice. So if the need for leave is foreseeable, like I'm going to have surgery in 2 months, then you need to give at least 30 days notice. If the leave is unforeseeable, then the requirement is to give notice as soon as practicable, which generally means 1 or 2 days. Now, the ABTA can actually work with FMLA. So let's say that you have used up 12 weeks of your FMLA leave and you're not ready to go back to work yet. Maybe your doctor's saying, I want to do one more scan before you head back next week. You just need a little more time. You may be able to ask your employer for a reasonable accommodation under the ABTA for additional time off. And as long as it doesn't pose an undue hardship for the employer, they have to provide it. Now, this only works if the additional time off needed is for a specific period of time. For example, I need 1 more week off or 1 more month off. It can't just be, well, I'm still not feeling great, I'll call you when I feel better. Now, a lot of times people will ask me how to use their sick leave and FMLA time. And again, here the answer really depends. It's going to be your own situation. Employers can have a company policy that requires you to take any sick or vacation time that you've stored up concurrently or at the same time as FMLA leave. And a lot of times people get upset by this, but it actually allows the employee to use the FMLA's job and health insurance protection and get paid. Now, if the employer doesn't have this policy, then the employee can actually request to substitute their unpaid leave with paid leave. So either the employer can require it or the employee can request it. And you may be thinking to yourself, why would someone want to take sick time and FMLA time concurrently? And the reason is that as long as you are on FMLA leave, you are protected. Your job is protected. Whereas if you're just out on sick leave or disability leave, your employer has no legal requirement to keep your job. So again, for more information and some more examples about how the FMLA works with other laws and benefits, we have a recently released quick guide on our website with some examples. Now, there are also some state leave laws. They're all very, very different, but some of the things that states have done to improve leave laws have created FMLA type leave for smaller employers. So for example, in Maryland, you're protected under the state leave law if your employer has 15 or more employees. As I mentioned, some states have expanded the definition of family. Some states have created some paid sick leave options. And so Triage Cancer has a chart of state leave laws on our website where you can find some more information about what's happening in your state. Now, you may have been wondering why I'm spending time talking about the FMLA when this webinar is all about returning to work. And the reason is that the FMLA can be used for more than just taking a large chunk of time off. It can actually be used in smaller segments of time. So for example, you might need to use FMLA leave for 1 day for a follow-up doctor's appointment. Or maybe you need to take every Friday off for radiation. Or maybe you just want to use FMLA when you're on days when you're not feeling well. This is what we call intermittent FMLA. So the FMLA can be a really important tool for returning to work as well as taking time off. Now, if you decide to use the FMLA for something like a doctor's appointment that's only going to last 2 hours, can you do that? And the answer is probably, but it's going to depend on your employer and your job. Because you can use FMLA leave in the smallest increment of time that your employer normally allows for sick leave or vacation time. So if your employer has a policy that only allows you to take half days or 4-hour increments as the smallest period of time, then you have to take 4 hours of FMLA off, not just the 2 you need for doctor's appointment. And then there's some professions that make it difficult to take smaller increments of FMLA time. So if you're an airline pilot that has a 6-hour flight across country, but you only need 2 hours for your doctor's appointment, well, you're gonna probably have to take all 6 hours off. And now if you're in the wrong city for your next flight, then you might have to take off the additional time as well under the FMLA. So it's really, really specific to the position. And again, one of those things where it can be useful to look in your employer manual to find out how your employer is gonna treat that. For more information about the FMLA, again, ABTA and Triage Cancer teamed up to create this quick guide about the FMLA, and of course you can find more information on the Triage Cancer website. all of our quick guides. We have stuff on employment, as I've mentioned, but also disability insurance, health insurance, finances. And then Triage Cancer also hosts monthly webinars on various cancer survivorship topics. One that I think might be particularly interesting to folks is our June 21st webinar, which is an update to our healthcare system. You may or may not have heard, things might be changing. So we're gonna try to keep you as up to date as possible with what's going on and how it impacts our community. And then I'm happy to open it up to questions now, but if we don't get to one of your questions or if something pops up, here's our contact information. You're welcome to email us. I also hope you will connect with us over social media. And then one last thing, if you are anywhere near Oklahoma City, Madison, Wisconsin, or Morgantown, West Virginia, Triage Cancer is hosting 3 conferences this year where we spend a whole day talking about cancer survivorship topics, including employment and finances and health insurance. So happy to take some questions now. I'll turn it back over to Vincent.
Great, thank you so much, Ms. Bryant, for a great presentation. We will now take questions. If you have a question you would like to ask, please type and submit it using the question box in the webinar control panel on the right-hand side of the screen. So the first question we have is has to do with people asking for reasonable accommodations. If someone gets denied or if they feel that the process has been stagnated or stuck for some reason, maybe their employer is not openly communicating, what do you suggest people do in those cases?
So it's a really common problem, unfortunately, and it usually stems from the fact that a lot of supervisors are not trained to be supervisors. They don't necessarily understand their legal obligations to engage in that interactive process that I was talking about. So I would say you have a couple of options, and it's going to depend on how you've gone about this. So if you started with your supervisor and that didn't go well, maybe you can take it to HR. There's some employers, especially large employers, that actually have like a reasonable accommodation consultant that can help work through this process. I definitely suggest using the Job Accommodation Network tools. But the reality is that sometimes you're just not going to be able to solve it yourself with your employer. And that's when I would suggest contacting the Equal Employment Opportunity Commission, or the EEOC. That's the federal entity that enforces the ADA, and they have a online complaint process that you can go through if you really feel like your employer isn't following its obligations under the ADA. You can go through that process and have the EEOC step in.
Thank you. Another question has to do with finding a whole new job or career after diagnosis and treatment. If someone is considering finding a new job or new career, do you have any suggestions for them? And I just want to say that the ABTA does have some resources for this kind of career change, but I wanted to see what you had to say about that.
Yeah, it's really common for someone who's gone through an experience as life-changing as a brain tumor diagnosis to change careers. And it could be for a number of reasons. It could be about a new capacity, and it could be about finding, having a new purpose in life. So it's very, very common. The couple of things that I would say are to think through disclosure. So are you going to disclose in your new job search process about what you've gone through, and when are you going to disclose? So I point you back to that quick guide on our website about disclosure, triagecancer.org, to really think through when is the most appropriate time to disclose. And then I would also point people to our great partners in the community, Cancer and Careers. They have a myriad of job search tools on their website. They have a resume review service. We partner with them on webinars and educational events. So for someone who's sort of thinking about how to finding a new job, whether it's in a new field or a field they used to be in, I definitely recommend their services.
That's a great resource, thank you. Someone had a question about what role does someone's doctor, primary care physician, surgeon, etc., play in sort of reinforcing that someone has a disability or some other aspect of their functioning that could affect whether or not they get reasonable accommodations. Do you find that people work with their care team on these issues?
Yes, and if they aren't, they certainly should be. So the healthcare team should absolutely be made aware of the fact that somebody is asking for a reasonable accommodation. And the reason is that employers are entitled to ask for something called medical certification to certify that the employee is in fact eligible for a reasonable accommodation. And this is also where we get into the conversation about disclosure. So you may not want to disclose to your employer that you've had a brain tumor, but you want to access an accommodation. You have to have a conversation with your healthcare team about what exactly it is that you're disclosing to your employer. Otherwise, they might just write down brain tumor on that medical certification form. So it is a really critical thing to involve your healthcare team, but then to also have a very honest and open conversation with what you're choosing to disclose. You have the right to keep this information private. And the way that this works is that a lot of times, as I've mentioned, it's the side effects of treatment that give rise to the disability. So if you're suffering from extreme light sensitivity, that is what gets written down on the medical certification form. You don't have to take the extra step to say, due to a brain tumor diagnosis. So please work with your healthcare team, and please have open, frank conversations about what you are disclosing and what you would like to have them put on a medical certification form.
Okay, well, that's all the time we have for today. Thank you all so much for joining us, and thanks once again to Ms. Bryant for her wonderful webinar presentation. Aside from our free educational webinars, the ABTA has a variety of programs available to help connect patients and caregivers with information and resources to help support them in their brain tumor journey, as well as publications and resources for healthcare professionals. For more information, visit ABTA's website at www.abta.org or call the ABTA Care Line at 800-886-2282. Let's pause for just a moment to conclude our webinar recording.